Right, today's question: how do you typically determine the dosage of rTMS if a patient isn't having much pain? Do you always go to 120% of the motor threshold? Okay, so this person assumes that we go up with the dosage to 120% unless the patient has pain. I think he's what he or she is implying. Okay, so the approved TMS protocol is actually for 120% of motor threshold. So what is motor threshold? This is the minimum amount of magnetic intensity that will cause a movement of the patient's thumb. Okay, so that would tell me for your particular brain what is the what do we call it, like the excitability of your brain. Okay, like what is the minimum amount of magnetic pulse that will cause your brain cells to get excited, to get action potential, or MEP, what we call it. Okay, all right, so in this situation, then we multiply that number by 120, right? So 120% of that number. So let's say that that number was 50, for you. 50 is 50% of the maximum energy of that particular machine, caused you movement of your thumb. Then we put that coil in the DLPFC and we set it at 60. Why 60? Because we want 120% of the motor threshold, right? So if the motor threshold was 50, then we need 120 of that, 120% of that, which is 60, okay? All right, now if I take that person and put them on a different machine from a different manufacturer, their number would be different because we are adjusting to that particular brain on that particular machine for the movement of their hands. So that number could be 55, and then we'll set the machine at, I don't know, like basically 68 or something like that, okay? So then do we do that from the get-go? Do we put the patient on 120% of their MT right away? Well, not really, because if the patient, has so much pain, in the first treatment session, because you've never had this treatment before, so you could have some tap-in sensation, sometimes it's a little bit discomfortable, some patients just could have headache because of it. So if we're starting with 120% from day one, then the patient could have, headache that would stop them from continuing the treatment, and they might not be compliant with the treatment and not like it. So what we do is that we start with 90% of motor threshold, and then every day we increase it by 5%. Okay, so that example that I gave about a patient with 50 as their MT, then basically we start 90% of that. What is 90% of 50? That would be like 45. Okay, the next day they will come in, we put it at like maybe 47 or 48. The next day they come in, we put it at 50. The next day that they come in, we put it at 53. The next day that they come in, we put it at like 55, 56, all the way until you reached 120%, which takes about 6 treatment sessions or so. So technically by your second week of treatment, you should be at that 120%. I find that to be very good for patients' compliance with the treatment and decreases the chances of headaches significantly. And we almost universally do it for all patients, except in some exceptions when a patient had already had TMS before and they know how it feels and they know what to expect, then we start with 120% right away. Or if a patient MT was very low, that even 120% of that number is not, they barely feel it. Like let's say someone had an MT of like 35 or something like that, so we can set it at 120% and it would not bother them at all. All right, what if a patient does not tolerate 120%? We started at 90, we increase gradually, they're still having pain that we cannot go up more than that, then we stick with that maximum number that they can tolerate. When does this happen? It happens when someone's MT, like motor threshold, is really high. Like let's say somebody is at 90% of the maximum intensity of the machine, right? Technically their 120% is going to be what, 108, and the machine cannot go more than 100% of the machine. You see what I mean? So the maximum intensity that this patient is going to reach up to is going to be 100, right? And even with that, in that situation, we if the patient did not tolerate that 100 and they're stuck at 90, then we keep it at 90. Conditionally though, that we still want to be that number to be above 90% of MT, okay? So we go up gradually, we start with 90%, we go up gradually until we reach 120%. Let's say we put the machine at 90% and the patient did not tolerate 90%, okay? And they're like, I can't take this pain, you have to drop it down. Let's say that motor threshold is high to start with, and we dropped it down to 80%. Then the next session we're going to titrate up at least to reach 90%, or patient tolerance if we can go beyond. Let's say that they were not able to go above 90%, we'll be okay with 90%, but I would not be considering that adequate treatment if the patient did not tolerate 90% of their MT. where did I come up with this, right? Like, why 90%? 90% was found in some clinical trials, particularly with theta burst stimulation, to actually even more potentiating than 120%. So there is activation of the brain cells at 90%. So that's an acceptable stimulation number. And when I showed in a previous video the intensity that we use for right-sided treatment, in a couple of, well, at least 3 of those, major clinical trials that were using 90% as well. Okay, so 90% is acceptable number. Anything below that would not be acceptable. We always aim to 120% if the patient can tolerate that. Hopefully this answers the question. Disclaimer: although I am a psychiatrist, this is not a professional advice, as I am not familiar with the specifics of your unique situation. Please contact a psychiatrist in your area with more questions. This disclaimer is added to my answers on social media after consulting with American Psychiatric Association. Thank you.